We have to continue to maintain appropriate caution and care to ensure that we keep our staff and patients safe from COVID, as well as the maintaining capacity within the hospital to deal with surges that can happen with infectious patients related to the pandemic.
Safety is essential in everything we do. It always has been. High quality care, safe care has always been essential. But COVID is a new virus. It's a new enemy, so to speak, in terms of keeping people safe. So we have to ensure that we're following the best practices and protocols in order to keep everyone as safe as possible. When you show up at the hospital, it's going to be a different experience than it was in February 2020. All patients, visitors, and staff are being screened at the front door with a series of questions to look for symptoms of COVID-19. You'll see everyone in the hospital wearing masks at all times, and that can be quite jarring for people. But it's all being done to keep both patients and providers safe.
Virtual visits are not going to replace in-person visits, but a whole bunch of them can. And I think it's exciting that under the challenge and the crisis of COVID-19, we were able to pivot and transform virtually overnight to a world where virtual care has been sort of an accepted and acceptable and an effective way of delivering care. I had the misfortune, I guess, of requiring urgent services recently myself, and did have the opportunity to experience an emergency visit and subsequent hospitalization here. The important part of this is, from my experience, we give great care here at LHSC, and I want to reassure the public that not only is there great care being delivered, but it's safe. If you have an urgent healthcare need or an emergent healthcare need, please don't wait at home. Please come in. We will keep you safe. I was kept safe during that time for exposure myself to COVID, and it will be the same for you. I want to express my thanks to those of you at LHSC and in other healthcare provider organizations for the great work that you're doing on the front line. This is a kind of thing that we've never seen before, and people are putting it out there with courage and truly being professionals in doing their best for those that they serve. And it was very moving and compelling for me to experience firsthand.
It has been the most inspiring experience of my career, actually, to see providers and administrators and frontline workers of all types work together despite huge amounts of information coming from all different directions, and having to process that information, protocols changing literally by the day that normally would have changed in the course of years or months. And our teams have just been exceptional in, I wouldn't say rolling with it, but embracing it and embracing the change that needed to be made in order to keep providers and patients safe and still provide high quality care. I work shifts on the weekend in the emergency department, and we were talking about, between patients, talking about how great of a job our community has done with physical distancing and maintaining safety. And thankfully, we're on the back end of that wave right now, and hopefully with the new protocols in place, we can continue with a low level of COVID in the community and eventually get rid of it. But a huge thank you to the community for abiding by the physical distancing and masking and all those other things that are more than an inconvenience for people, but really helped slow the spread.
Thank you for being patient, and thank you for understanding that these are times that we have not had to face before. I know that this has to be incredibly difficult for people to be waiting for care to be delivered that is important to them, and it's important to us too, and we're doing our best, and we will get there as soon as we possibly can.